Hello everyone, I'm Dr. Samir Malampati, consultant cardiothoracic and vascular surgeon at Renova Century Hospital, Banjara Hills, Hyderabad. Today, I want to tell you about the effects of smoking and the surgical cases which we do routinely affected with this. Smoking is a very deadly factor affecting our lungs, and most commonly we see emphysematous disease. So emphysema comes as a part of spectrum of chronic obstructive airway disease. సో దీంట్లో ఏంటంటే మన లంగ్స్ అనేవి స్పాంజెస్ లో ఉంటాయండి. బికాస్ ఆఫ్ స్మోకింగ్ ద ఎలాస్టిక్ రీకాయిల్ ఆఫ్ ద లంగ్ ఇస్ లాస్ట్. సో వాట్ హ్యాపన్స్ ఇస్ the lung will inflate, but it has difficulty in deflation. Means the intrinsic PEEP of the lung is affected. So that's why it happens where the inflated lung will stay in that position, and it may result in various disorders like pneumothorax or various blebs in the lung as emphysematous blebs or Buller's disease of the lung. So these commonly we see. So which patients require surgery, which patients can be medically managed is a big dilemma. దీనికి various societies like European Respiratory Society కానివ్వండి, లేకపోతే American Thoracic Society has given multiple guidelines to manage these patients. So what is the basic changes happening in this is the recoil capacity of the lung is lost, and it is an irreversible change. And these patients need to be medically managed either with oxygen therapy or and bronchodilator therapy and IV steroids. So how far these patients success with the medical therapy is very much limited. So the ultimate goal for these patients may need to be land up with surgery. So these all effects have happen only with because of smoking. And then what surgical options we do is, so and when do we do surgery for these patients is a $1,000,000 question again. So why? Because the patients with these diseases have reduced lung capacity. So in our terminology, medical term, we tell it as FEV1. So these patients who have FEV1 less than 30% have predicted survival of only 3 to 4 years. So in order to live a good quality of life, we may need to do a better surgery for them. So again, what surgery is anticipated? So it's again the historical aspect started from 1950s onwards, and it was refined in 1980s by Dr. Cooper et al. And team, where they have advised to do a lung volume reduction surgery. And honestly saying, this procedure is very good, limiting the mortality rates and best outcomes with this procedure. So we at our center have done multiple cases like this, and we advise you for a VATS procedures, particularly where we do a keyhole surgery, and we approach through a small incision of around 3 to 5 centimeters, and the disease segment of the lung part, that is 20 to 30%, is removed. And also in the same sitting we may do for the bilateral lung diseases. Before going to a huge thing like a lung transplantation, always lung volume reduction surgery is best to go. Okay, thank you.